Hello everyone, welcome to Parenting Up Zim, and I'm Stay. Now we're here to discuss all things parenting, from your preparatory stage, your pregnancy, kutorera vana kwacho chaiko chaiko. We have different experts come through in the show to help us out in our parenting journeys. Now what I know is apana chinchakaoma sekunyora exam rasina kuverengera, guys. So therefore we have to help parents prepare as best as they can for their parenting journey. Saka, we're going to have a gynae come into our second segment to help us with preconception planning stage, right? What are we supposed to do? What are the do's? What are the don'ts? Manonos and the happy. But before we get into all that, here are some true or false quiz questions for today. Number one is, the shape of your belly predicts the gender of your baby. True or false? Legend actually says if you're having a boy, and if you're having a girl, actually, your stomach muscles stretch with subsequent pregnancies. So if a woman's belly is higher up, guys, it just probably means it's a strong pregnancy, or a strong abdominal area. Simply put, guys, or probably it's your first time. Quiz question number 2. Your heart actually grows bigger when you're pregnant. True or false? It's actually true, guys. Your blood volume increases by up to 50%, and your heart beats faster and stronger, growing larger to help keep the miracle in your womb. Saka, it's perfectly normal. Now my question would be, Saka, kana hati yacho yakura inozoka to its normal size here? But could it be, Saka, the reason why vanhu vanenge vaine pamuviri vachizoita moyo vamwe kuti moyo unenge wakura? I don't know. We'll get to the bottom of all that. Question number 3 is, babies can be born with a tooth. True or false? Yeah, I don't know. Contrary to popular beliefs, because I don't know, but let's wait for the answer. So it's actually true, guys. And actually over 2,000 babies are born with one tooth, and these teeth are actually removed. They are known as natal teeth. But I don't know. We're going to ask our expert when she comes through. But yeah. So now the main question is, is it a gynae thing or a PD thing? So now I'm also curious. Do stay tuned to Parenting Up Zim. We'll be right back. Welcome back. You're still watching Parenting Hub Zim. Now, as promised, we're joined by our good doctor. No, actually, my good doctor, Dr. J. So my gynae said I should do this, do that. Now she's here. Some of you might actually know her from radio. Dr. J. It's actually Dr. Jemedze. That's the full name. Dr. J, welcome to Parenting Hub Zim.
I'm happy to be here. Thank you.
Before you came, we've been discussing preconception care and the dangers this parenting journey planner, right? But before we get into that, please tell us about yourself. Are you a mom yourself?
Yes, I am a grandmother, most importantly, and I'm a mother of 3.
A mother of 3, wow. But what about 3? Were they planned, especially the first one? God planned for you, because this is what you you know how it is.
That's an important question. Unfortunately, they were all pleasant surprises from the Almighty, even though we encourage you guys to plan. Let's do as we preach, not as we do.
It wasn't going to oops, oh, thank you, God, we're having another baby. No, I was really noted we'll plan. Saka, but now before, like we're saying, planning, how do I plan? Because am I fertile? Am I fertile, or I need to then look into fertility? How do I know if I'm a fertile person or not?
Okay, so for ladies, it may be relatively simple, assuming all things equal. If you're having a regular cycle that is coming every month, and being regular doesn't mean it's coming on the same day. because women are different. Cycles can range from 21 days to 35 days. As long as it's coming every 35 days, it's normal. As long as it's coming every 28 days or 21 days, it's normal. So if you're planning to get pregnant and you want to know if you're able, keep a diary or a calendar where you mark the first day of your period. And then you mark another first day. Even if you're going to bleed for 5 days or 3 days, start to start will give you the duration of your cycle. But remember, all things being equal, because there are many other factors. You need to have your tubes open. As for the fathers, it's difficult to know if they are fertile, apart from them having to undergo a semen analysis.
All right.
Yes. Kwete semen analysis yekumusha yekuti mbeu iri kunyora here kana kuti haisi.
Right.
Yekulab. Inonyatsotarisa kuti mune mamiliyoni mangani ari kufamba here, ane shape yakanaka here, kala yacho haina kuita creamish yellow here, is it grey, and so on and so forth. Zvinongobatsira to be certain.
Is there something we can do in the labs as well for women kuti tione kuti mukadzi uyu anokwanisa kuconceive, anokwanisa kubata pamuviri?
Yes, you can actually track ovulation, because when a woman ovulates, there is a surge in the hormones which can be done. A woman can have a female hormonal assay. She can even have her tubes checked.
Right.
Yes.
Yeah.
If you're ovulating, you can also see a slimy discharge inobuda kunzira sikarudzi, then you know kuti chances are that you've ovulated. Others will have some ovulation pain, just some sided pain left or right, depending on which side they are ovulating from.
Right. You know, tuma telltale sounds kuti ndokwanisa unginda kubata pamuviri time inoi.
But bearing in mind kuti ku-ovulate does not equal to getting pregnant. Yes, right. Because the tubes have to be working well. Kune vaya vakaita busy vakawana tuma chlamydia netuma gonorrhea vari kucollege, vanogona kunge vaine matubes akablock. Saka zvinoda kuti zvitariswe zvioneke.
You said something about chlamydia and blocked tubes. Ma-STI mamuchitaura yaya anogona kukanganisa munhu kuti azoitadza kuita pamuviri. Zvinenge zvanatsofamba sei?
Okay, very important and very correct. And kana tiri kuti munhu ka tikutaura mukomana nemusikana vese, you can get your sperm duct blocked because you have suffered a sexually transmitted infection.
Right.
Paunozoenda for semen analysis, unozwa kunzi une azoospermia, kureva kuti hapana mbeu iri kuwanika mufluid yauri kuproduce. Uye kuproduce fluid kuya hakureve kuti mune masperm arimo imomo. So izvozvo zvinoitika. Then kumadzimaiwo kune mafallopian tubes kana kuti maoviducts. Iwayo they can also be damaged, they can be blocked. Vamwe vachizopedzisira vaita ectopic pregnancies, vamwe vachizopedzisira vatotadza zvachose. But it doesn't follow kuti munhu wese ane mablocked tubes akamboita musikana.
Busy.
Yes.
All right, there you have it. Kuma college, I'm just going to say this once. Please don't want some jolo because the blocked tubes chichi mazvinzira doctor achitara mega. Nyaya consumption ababa when I'm planning. There's much talk of folic acid consumption. Folic acid ndeyangu inini mai here kana kuti supposed to be for mwana wanichazoita. Inoshanda sei munei folic acid?
Okay, so folic acid, it is what it is, folic acid. Inobatsira kupreventa maneural tube defects. Kuti mwana aite brain kadiki, microcephaly, kana kuti ite maspinal defects kumusana, musana usanyatsogadzirika zvakanaka. So inotorwa as you are planning to get pregnant and up to the first trimester, but panonyanyoshanda is from 3 weeks to 9 weeks. Ndo panogadzirika mwana, all the vital organs, all the organogenesis, ndo painoitika ipapo.
For someone who's trying, and I have been on contraceptives for a very long time, at what point am I supposed to cut off my contraceptives? Pani period remote kana uda kutanga utry chimbotosiya periods for this long, or zvinofamba sei kana ndichida kusiya periods kuti nditange kutry?
I would say it depends on the type of contraceptive that you are on. The pills, you take them every day because ideally anobuda system every day. Ndosaka uchiti ukajamba, you may actually then continue asi watoine nhumbu because ovulation inenge yatoitika pawajamba ipapo.
Right.
Things like subdermal implants, implanon gel, reversika after about 3 days. Kana iri copper T, the intrauterine contraceptive device, we expect you to be fertile immediately after removing it. Culprit is the Depo-Provera, the injection. It's recorded 9 months, maybe delay, but it doesn't follow it if you're on depo. If you stop it, you have 9 months. Because every woman is unique and different.
Right.
Some will conceive. Even this week, I had a woman who was saying, I was on depo, I didn't skip, but now I'm pregnant.
Ish.
That's how fertile some people are. And then you can have some saying, it's now 2 months I've been trying, I'm not getting pregnant. Then what family planning? I was on depo. Then I say, it's the depo. So it really depends. Some will stop family planning anticipating that there will be a delay, and then they will just come back pregnant. And they will be like, I wanted to get pregnant 2023, but not this early. I was hoping.
We're still in January.
Yes.
So really differs with people.
Some have even told them, Chiremba, man visa jadeo. Just last week I had another one saying, man visa jadeo a year ago. Up to now I haven't conceived. Then I'll just tell them, you know what, this is shows good. Jesundish. Kunwa family planning might not stop you from getting pregnant. Now you know better. Why is it even difficult to then get pregnant? Wasia family planning and all. Ideally, when everything is level, we are ovulating, babambe ovanayo, more than 49 million, this is in right direction, everything is really right. When you ovulate, your egg is available for fertilization over 18 to a maximum of 48 hours. So, pane need for regular meeting, so that at any point, musystem mako mnembewe ya baba, and that boosts your chances of conception.
Right.
So, for those who are trying, ideally, every other day or every day would keep you with adequate mbeu system.
Right.
Yekuitwa fertilization iitike.
Okay, you've mentioned nyaye kuti zvinhu adequate, but then iriyo nyaya mbeu, like how long does the sperm actually survive inside of a woman?
Okay. Up to 5 days. But patozosvika ku5 days, zhinji yacho mbeu inenge yaparara isisina matails, isagone kufamba, quality yacho inenge ichidzikira with time, but it can go up to 5 days. Tiri pambeu ipapo togona kungobatsirana futi kuti prolonged abstinence haizonyanyise kubatsira kuwedzera mbeu kuti iwandise, because you've been abstaining for yes. Right. You need regular replenishing, because mbeu inoproducwa on daily basis, you get a production.
Right.
Yes.
Ko manje saka munhu akabata pamuviri, right, and they are not aware of it, obaramba achinwa ma-tablets, azvizokanganise mwana zvekutosvika pakundokwanisa kuita miscarriage here.
Okay. The types of the pills that are available now, my mode of action, mashandiro awo anofanirwa kuita kustopa ovulation, haana materatogenic effects atingatauri kuti anokanganisa mwana, but would encourage kuti the sooner you realize kuti you're pregnant, or once you suspect, then you need to stop.
Difference iri paha, because ndozogona achita mamwe acho anoomesa mukaka, mamwe aomese mukaka really.
Okay, so tinongoti mapiritsi evanhu vari kuyamwisa, but secure, like you rightly pointed out, secure, it's a progestogen only pill, harina estrogen. Why do we give it? Why not estrogen a pill during that time? Because remember, you're secure, you need to take it same time, otherwise you start spotting and bleeding wrongly, or you may even get pregnant. If you take a course of antibiotics and you are taking secure, you may actually wake up pregnant. So, but we still need it. Why? Because harina estrogen. With estrogen now, you have just delivered. Machanges of pregnancy asatadzokera back to normal. Uri pa risk yekuklota ropa mutsinga, deep vein thrombosis. Estrogen is also a risk factor for that. And when breastfeeding is not well established, yes, it can affect the lactation process. But during the pregnancy, estrogen itombodiwa pakugadzira maglands emukaka. But once breastfeeding is established, then you're having problems to secure, you can nicely switch to control.
Yeah, saka ipapa tanyanswabata pamapiritsi apa talk. I'm going to hold you for a bit. We're going to go for a short break. Stay tuned to Parenting Abzim. We'll be right back. Welcome back. You're still watching Parenting Hub Zim. Now, before we went for the break, Doc, ndabvunza nyaya yekuti mwana anogona kuzvarwa aine kazino. Zvizodzanzi zino rinozobviswa, but yeah, nyaya iyoyo inogona kunetsa. Panopumwa muroi akawanika ipapapa.
Very true, very, very true. Asi zvinoitika. Katinoti tumanatal teeth tunongobviswa immediately after delivery, even though the occurrence is very rare. mwana wese anotozvarwa achine mamilk teeth ari mukanwa ngonda anenge akafarwa nemagums tisingaoni. Vamwe vana vanozvarwa netumacysts on their gums zvokuti munhu akatoona anototange tumazino. Yes, but zvinhu zviri normal, hapana chivanhu. Kuchina they consider it a bad omen. Malaysia they say it's good luck, but in essence medically it doesn't mean anything.
Right. Before we get into the emotional side of things, secondary inhalation so kuti maybe ndikugara nemunhu ari kuputa fodya inondi affect here my chances of conceiving kana kuzokanganisa mwana as it would kana dai ndandiri ndandichiputa.
Okay, so secondary it's you muri kufema zviri kuputwa nevari kuputa, but ngatitangire kune vari kuputa vacho. The quality yembeu yavo is affected by smoking, and it has been noted kuti vanosmoka vachinja vanosmoka vachinwa futi zvese izvozvo zvinorwisana nekukubata kwenyu pamiri in terms of the quality of the sperm, abnormalities in the sperm. So ivo primary smoker vanoaffectwa. Secondary smoking, yes, it will affect more so if you then eventually get pregnant. Inokonzeresa up to 23% of stillbirths uchingofema zvaputwa nevamwe kudhara, and then pane about 13% chance yekutoita mafetal abnormalities. And what makes it tricky ndezvekuti munhu anozozva kuti ane nhumbu yane 3 months, mwana anogadzirika between 3 and 5 weeks. So paari kugara nemunhu wake ari kuputa apa, mwana achigadzirika, vana vanogona kutokuwara zveshuwa
in those very early stages.
Yes.
There you have it, parents. There's need to compromise for mwana, really. If probably you're smoking and awatadza kusiya pamwendi webaba, it's better kana zvatonesa kutoenda kure namai that time that you actually smoke, yeah? Okay, doc. Saka panyaya the emotional side, like I said, ndikaita stress inini semukadzi, zvingandi affect my chances of conceiving it, kana kuti it's not even related to my chances, papa?
In an indirect way, yes, because some people are stress eaters, and we said weight gain is inversely proportional to your chances of getting pregnant in that regard. And also stress hormones, stress levels. Kana uri stress, your body no produce adrenaline, is a stress hormone. So the stress hormones like the cortisol, prolactin, adrenaline, it'll get better part of you. Prolactin levels zikatokwira, period inotostop. Once you stop your period, haucha ovulate, chance yekuita nhumbu yatodzikira. And munhu akarwarisa stereki, period inomira, because my stress levels anenge akwirisa. Somehow nature is done it in a way yekuti kana une stress iwe nhumbu general haingobati. Not to mention the obvious, kuti kana une stress maybe kutosangana kwacho hamusangani because you're stressed. So in a way, directly and indirectly, emotions, yes, they do affect. And it's actually a double-edged sword, because probably wangoita delay yekuita nhumbu, then you stress. Wastressa wakutodelaya
worse foot.
Yes, saka tongofanira kungoappreciate kuti vana zvipo zvinobva kunaShe nenguva yaShe.
But a happy space will encourage.
It does encourage really things to happen and you to be in a healthy state before you even start. Yes.
Papa, doctor. Now, pani mataranya planning, it's important. We've noted that. Da plana pepe vanarupiwa pressure on social media. There's a lot of talk around nyema water birth. We've seen videos surface on the internet and whatnot. Mr. Doc, would you recommend someone to try that?
Very old school. I am very old school. I don't know what social media is saying. However, tiri muZimbabwe, mvura iri kutonetsa. Let alone uri kuitira kupi water birth yacho kumba here yakachena here mvura yacho. Pane marisk aripo ekuti mwana anoneta, ari kumonitwa here mwana wacho. Tomboti wadecide kuita at an institution, are you sure kuti pari clean enough for you to do? I think tine mamwe fundamentals are still in place for us to then encourage it. However, every delivery inofanira kuti follow up nema anonzi ma-oxytocin anoita kuti usableed ropa rakawanda, placenta inofanira kubvisika zvakanaka, and value yacho yauri kunyatsowana from having it, and safety kumwana. It's actually questionable. Not to even mention the right temperature for the water.
Right.
Yes. So I think a lot needs there to be looked at.
Okay. Now, on a separate note, Rango, yema water birthing danyanso ibata. There's a couple of, they're actually close friends of ours. Vakaita a scenario kuti vaka nunuka kuenda ku hospital. It was actually their last baby. Mwana ndo babuda mulumbu wachiri mumota on their way. and they had to work out but vakasvika mwana right though, what would you encourage munhu aita mistake yoyo kuti anonoka kusvika mwana abuda vari mumota, munhu anoita sei kuti mwana ange ari safe?
Okay, andingada hangu kuvaticha what to do when they are late. Because it's very dangerous.
Right,
it means you've labored at home with no monitoring yemwana at all. So what's at stake? Mwana akabuda, the first few moments are critical. Growing brain ikashare oxygen, mwana anogona kutoita cerebral pulse for life, mwana anogona kutoita delayed milestones for life, mwana anogona kutongoita hake dofu muzonetsana nemwana imurimi mune problem. But mwana ngazvarirwe panzvimbo iri ideal to protect the baby, not to mention sepsis, infections, nokuti kamwana kari delicate. So kana to mothers, whenever you feel kuti ndasvika 9 months, ita uchienda kuclinic, uchienda kuna chiremba wako, uchimonitwa, ukaudzwa onzi what are the danger warning signs: breaking of waters, bleeding, passage of shore, labor yangu yakutanga, tightening of the abdomen, coming and going. Don't wait for it to be happening 2 in 3 minutes and so many things happening. Kurumbidzai kuenda. Road dzedu congestion chaidzo. So many things are so wrong to delay in going. However, toti zvaita fast, maita zvese zviri right, and zvaitika so fast.
The baby is just coming.
Ndo patiri kungoti. In some institutions, they're encouraging people to have a clean razor blade, a set of sterile gloves, and cord clamps anotengeswa kumapharmacy.
Okay.
So you may just want to have cassette kako. Not that you're anticipating kunonoka, but you can even present them when you get to the hospital and you will not be charged.
Right.
Just 2 umbilical cord clamps and your clean blade and gloves. So kana zvaitika, it's important to keep the baby warm. It's also important, even kana musina chekuchekesa, just tie. Some have even tied with shoelaces. And keep the baby warm. Right. Cover the head. Right. Wipe the blood. Cover the baby's head. And kana zvatoomesesa, putiridzai mwana necotton wool yamai, because you're en route to hospital anyway. Cover mwana necotton wool yese. Adzirwe. Momuisa muka plastic bag kanenge kaine pakavhurika. I'm not encouraging deliveries away from institutions, but kana zvaitika, keep the baby warm. Covering the baby with cotton wool, putting them in a clean plastic bag. Achikwanisa kufema, makakava musoro, will protect the baby from losing the heat.
Right.
And not kuti paabuda achema here, because muchanobvunzwa.
Right. Kuti mwana achema here, and you're gonna have to have the answer for that.
Yes.
Julie noted, vabereki hazvikunzi itai zvekutenga marazor blade muchengeta kumba mubatsirana muri 2. But if it does happen, mazvinzwira kuna doctor kuti how do you go about it. So yeah, on a separate note hazvo doctor, nyaya inongotaurika pamwe tinichipana pressure. So there's talk kuti there's certain sexual positions that encourage kuti munhu akwanise kuconceive easily. Is that medically proven kana kuti tinichingopana pressure zvedu mukufamba?
It goes beyond just being able to conceive. It has even gone further to saying if you want to have a baby boy or a baby girl, certain positions might actually help.
With the gender? With the gender,
but it's not medically proven.
Right.
So don't quote me there. Okay. As for sex positions, not quite. As long as because we're talking of 49 million sperms in 3 males and more than 15 million sperms in a male. And we only want 1 sperm.
Just 1.
So the positions really doesn't matter. Or even standing on your head soon after will not prompt movement in the right direction.
Hey, could you better faster?
Yes. Right. So yeah, I think that is just talk, no medical evidence. But if the sperm is deposited, remember we said when you're ovulating, the cervical mucus is slime. That is to allow the sperm to pass. So when you're ovulating, the passage is made easier, so they will just swim in the right direction.
Awesome, Doctor. We hope for the couples that are back home and are trying to conceive, this episode will help you get a healthy and happy pregnancy. Doc, it's been awesome having you today.
It was a pleasure. Thank you very much for inviting me.
Awesome, Doctor. This from us to you guys with so much love. Till next time. Bye-bye.